Nurse educators are known for influencing the future of healthcare by sharing knowledge and skills with the next generation of nurses. Like any profession, a nurse educator's career comes with challenges and rewards. Before starting on this journey, it's important to be aware of the pros and cons. In this video, I will discuss the challenges and rewards of being a nurse educator and highlight the significant impact that nurse educators have in healthcare. Being a nurse educator comes with its own set of barriers. So let's start with reviewing some of the challenges of being a nurse educator. Workload and time management. Nurse educators often struggle with heavy workloads as they juggle multiple responsibilities, including teaching, research, committee involvement, projects, administrative duties, and mentoring. Working on these multiple tasks and staying updated on developments in teaching and healthcare can become overwhelming. Therefore, good time management skills are required to prevent burnout. Limited guidance and resources. Many nurse educators work with limited resources, including budget restrictions, outdated technology, lack of staff training and equipment, and lack of leadership. Overcoming these challenges demands creativity, self-learning, leadership, and resilience from the nurse educator to be successful. Adapting to diverse learning styles. Students and nurses come from various backgrounds and may have different learning styles. Personalizing teaching methods to accommodate diverse learners can be demanding, requiring nurse educators to be flexible and use a range of teaching styles and resources to promote success among learners. Maintaining clinical relevance. Nurse educators must continuously update their teaching material as healthcare practices evolve to reflect current evidence-based practices. This challenge requires nurse educators to stay connected with the clinical practice and adapt their teaching methods to align with real-world scenarios. Therefore, it is best for nurse educators to remain connected to clinical practice to boost their careers. Addressing student and staff challenges. Nurse educators often support and guide students and staff facing personal, work, or academic challenges. Navigating these situations requires empathy, patience, and a proactive approach to foster student and staff success. Dealing with challenging students or staff can be time-consuming and emotionally taxing. Therefore, nurse educators must find effective ways to engage and motivate all students and staff, including those who may struggle. Salary. Nurse educators are not competitively paid for their years of education and experience. Specifically, academic nurse educators could be paid more. Clinical nurse educators have the potential to be the most paid nurse educators, but do lack the flexibility that academic nurse educators may have. Consider if flexibility or a higher salary is most important to you. If you want to learn more about the types of nurse educators and various roles, watch this video. Incivility. Incivility or bullying in the nursing profession is common. It is unfortunate, but nurse educators must be prepared to handle unprofessional interactions with students, staff, colleagues, and leadership. It is also important to consider your interactions and role in communicating with others. By the way, if you're enjoying this video, give it a like and leave a comment below. Let's now review some of the rewards of being a nurse educator. Being a nurse educator also comes with its many advantages. Making a difference. Watching your students or staff grow, succeed, and make a difference in healthcare can be incredibly fulfilling. One of the most rewarding aspects of being a nurse educator is the opportunity to shape the future of the nursing profession. You, the educator, can influence and inspire the next generation of nurses, instilling the values, ethics, and skills needed for success. Lifelong learning. As a nurse educator, you are continuously learning and growing. You have the chance to engage in research, attend or present at conferences where sometimes all expenses are paid for you, write articles for publication, and collaborate with other educators to stay updated on nursing education and clinical practice. Job security. The demand for qualified nurse educators is high, and this career offers relatively stable job security. With nurses in clinical practice and students who want to become nurses, nurse educators will be needed to support them. Building strong relationships. Nurse educators often develop meaningful relationships with their students and colleagues. The mentoring dynamic allows educators to witness the growth of others from novices to competent, creating a sense of pride and accomplishment. Also, the peer-to-peer collaboration and exchange of ideas among nurse educators contribute to a rich learning environment, benefiting both the students and instructors. Contributing to the science of nursing. Educators can bridge the gap between theory and practice by promoting evidence-based nursing. They guide students and staff in applying research findings to their clinical practice, fostering a culture of continuous quality improvement and patient-centered care. Nurse educators can also conduct research and lead evidence-based practice projects, becoming experts in their field. Diversity in teaching roles. Nurse educators can diversify their roles, engaging in teaching theory or clinical simulation education, leadership, and academic research. This diversity keeps the profession dynamic and allows educators to find a niche that aligns with their interests and strengths. This experience allows nurse educators to teach courses they are passionate about or specialize in nursing education based on their clinical interests. If you are considering becoming a nurse educator, remember that the challenges are growth opportunities and the rewards are the fulfillment of a lifelong commitment to education and healthcare. Let's celebrate the rewards and acknowledge the challenges because it's crucial to recognize that nurse educators are needed to nurture the future of the profession. Watch this video to learn more about how to become a nurse educator and this video on how to prepare for a nurse educator job interview. Let's empower, educate, and mentor together to foster the growth of current and future generations of nurses. Subscribe to the channel and see you in the next video.